Guys, so I'll be with you through your discharge process.
Okay.
Today's password is, nice to meet you. Today's password is parade.
Okay.
My name is Anna, but I go by Annie.
Okay.
I'm just going to update the board here, put my name, and today's tech is Noemi.
Okay.
And the chargers today is Kelly.
Okay.
We're going to shoot for discharge today between 12 and 1. The expectation is that the pediatrician will come by and see Johnny, and then your OBGYN will come by and see you at some point.
Okay.
So once that whole process is taking place, I'll do some discharge paperwork and then we'll go over it together in the room.
Okay.
One thing that you can do to kind of expedite the process this morning is to go ahead and call the pediatrician when they open. Clearly they're not open at 6:30 a.m.
Right.
But about 8 o'clock, give them a call. You'll go home today. You'll probably have a follow-up in like 2 days.
Okay.
That's a good judgment there. So go ahead and call and make that appointment. Sure. I'll cruise back by in the next couple of hours and check you out, do my assessment. If you need anything before then, just use the call light and give me a buzz.
Okay.
Okay?
Awesome.
All right, I'll see you in just a bit.
Appreciate it.
Knock, knock, it's Annie.
Hey, Annie.
Hey. How you doing?
Good. How are you?
I'm good. So, we've got all the discharges together from all the physicians. So, are you comfortable?
Yeah, I am.
Okay, we're just gonna kind of go over this discharge stuff here.
Okay.
And Mr. Smith, if you don't mind, you could at some point you can visit and join us for the discharge teaching, or if you want to go down and get the car seat, leave the base in the car, but just bring the car seat up, then we can help you guys put him in it before you guys go home. Okay, so let's start with Johnny's discharge. All right, so it looks like you made your follow-up appointment with Dr. Diaz in a couple of days. So it looks like on Thursday at 8:15 you'll be going back to see her. They're going to do basically a jaundice check and a weight check. Just make sure that everything's going well. Let's see here. There's just some admission data and some discharge data here on your paperwork. Head circumference, length, weight, APGAR scores, all that fun stuff. And then you can see his discharge weight from last night's last weight check. Also, his jaundice level is low risk. The jaundice is when your baby turns kind of yellow.
Okay.
It looks like Johnny passed his hearing screen. He passed his congenital heart disease screen. And as far as feedings are concerned, you're going to nurse him 8 to 12 times a day until he's satisfied. Wake him up at night if he's trying to sleep longer than about 4 hours. You want to be proactive at this point until your milk is in and well established, that you're just making sure he gets up to nurse.
Sure.
It takes about 2 weeks to establish a good supply of milk, so it looks like him losing weight for the first 3 to 5 days. There should be a plateau in his weight loss and then a slow, steady gain back up to his birth weight by about 2 weeks of age. We want you to keep track of pees and poops. He should have 1 wet diaper and 1 dirty diaper for each day of life leading up to the point in which your milk comes in. For example, if he's 3 days old, you're looking for 3 pees and 3 poops in a 24-hour period. So his output is a direct reflection of how well he's nursing at the breast. You know, you're looking for good nutritive sucks, you're listening for swallows, and by about day 4 of life, you should be seeing yellow, seedy, poopy stools. Okay. Let's see here. As far as keeping his umbilical cord clean and dry, essentially you do nothing to it. It's pretty simple.
Right.
It's going to fall off on its own in 1 to 3 weeks. In the meantime, just a little sponge bath with him, just warm washcloths, just kind of wipe him down. You can use lots of soap and water if you want, but the more soap you use, the more water you have to use, and it tends to get that cord re-wet. If it gets re-wet after it's dry, it gets smelly and mushy and gross and doesn't fall off very well. So about every
baths
until the cord falls off. Yeah, so every couple of days. You can wash his hair like normal. You know, you really need to use your fingers and scrub. You'll never push hard enough to hurt his head. So don't be worried about that. You just really want to work to get him clean. Obviously, never turn your back and leave him alone near a bathtub or near water. The plastic ring around the head of his penis will fall off in 5 to 7 days. It'll fall off entirely on its own. So don't help it along. Like if you change a diaper and you notice it's still just kind of hanging, let it entirely do its thing on its own. As it heals, kind of a yellow crusty film will form around the head of the penis. That's normal. Just leave it alone. You know, it's normal for the head of his penis to kind of swell out the top of the ring. And that's okay as long as it doesn't look discolored. You know, it's not turning white or dark purple, like it's not receiving any blood flow. But a little bit of swelling out the top of the ring is normal, okay? He was just circumcised this morning, so we are looking for a P within 24 hours. He was circumcised at 9 o'clock this morning, so by 9 o'clock tomorrow, you should see at least one PP diaper.
Okay.
Okay?
And if I don't?
Go ahead and call the doctor. Yeah. Let's see here. Keep Johnny on his back when he sleeps, just as you modeled for us here in the hospital. A firm mattress pad is best. At this age, please do not put him to sleep on pillows. Do not elevate his head with any pillows. There should be no loose blankets, stuffed animals, anything around his head in the crib. It is unsafe for him to sleep in the bed next to you at this point, so make sure he's got his own spot.
Got it.
Okay? If you decide to use pacifiers, we want you to wait at least the first couple of weeks until your milk supply is well established. You know that he's nursing well, the latch is good, he's gaining weight, and then you can use the pacifier if you'd like. Either way, change it out about every 3 months. It tends to get soft and break apart and become a choking hazard. You've got the bulb syringe here at the head of the bed. You're going to keep that next to you in the car seat or right at the top of the diaper bag. In the event that he's kind of gaggy or spits up, you want to be able just to get to that quickly. Okay. When your husband gets back up with the car seat, we can help you get him in it. Just as a reminder, you're going to put him in there with just his outfit on first. Okay. You cannot swaddle a baby and then put him in the car seat. The plastic piece should stay up here across the nipple line. You should not be able to pinch any of the material together. So it's a 5-point harness, and it needs to be fairly snug, and we'll help you do that.
Okay.
Okay. As far as just touching on safe sleep, you know that we've used the sleep sacks while you've been here. The American Academy of Pediatrics recommends that as the safest way to put your baby to sleep, okay? A little bit on safe sleep and reducing the risk of sudden infant death syndrome. You don't want Johnny to be too close to any blankets or anything that would kind of trap this carbon dioxide in his face. When they rebreathe that carbon dioxide, it slowly decreases the respiratory drive so that they just don't take the next breath. That's some of the thought that's out there on sudden infant death syndrome. They are now diagnosing it up to about the first year of age. So when you get home and you've got him, you know, from the car seat to the house or from the house to the Walmart, oftentimes moms like to put blankets over the car seat, you know, when you're walking in the wind.
Sure.
Just take that off. Don't leave him in any position where he can be trapped rebreathing that carbon dioxide. Okay? On that same note, please keep him away from all secondhand smoke, e-cigs, vapor, any of that stuff. He doesn't need to be around. Okay? When you get home with Johnny, in case of any emergency, you dial 911. If he's having trouble breathing, if you cannot wake him up, heaven forbid, or if he ever looks blue around the nose or the mouth. Okay? You're going to call Dr. Diaz if he develops a cough. That would be unusual at this age for a newborn to be coughing. Okay? If he's not keeping his feedings down. This looks like just copious amounts of breast milk that he's throwing up after he nurses, you know, projectile, large volume spit ups. If he's doing that, you want to call the pediatrician. It's normal as your milk supply starts to fill and you get larger volumes of milk. It takes some time to learn to digest larger volumes. So, you know, burping will become more important, trying to get good burps out of him so that he doesn't spit up. But little spit ups are normal. Little residual spit ups are okay. You're just not looking for large volume spit ups. If he's not feeding well for 2 or more feedings in a row, you need to call the pediatrician, okay? That looks like about 8 hours solid of him just not eating well. It's hard to keep him awake, he's not engaged, then go ahead and give him a call. If he's not peeing or pooping like he should be, he's not maintaining those, you know, pees and poops like we talked about for how many days he is. If he starts to look yellow, babies get jaundice from the head down. So forehead, nose, creases around the mouth, whites of his eyes. If he starts to look really yellow, call the doctor. If he develops any rashes, give Dr. Diaz a call. If you notice any bright red bleeding from around the base of the umbilical cord, go ahead and call, or from the circumcision. Okay. Now he was just circumcised this morning, so he might have little
spotting.
Little spotting, which is normal. But if you're seeing a constant oozing or, you know, a real saturated spot in the diaper, then go ahead and give the pediatrician a call. If he's crying or fussy for a really long time for no reason and you can't figure it out, then go ahead and call. Typically this looks like a few hours of just him unconsolable. He's clean, he's dry, you've burped him, you know that he's been fed. If you just think he's acting funny, trust your instincts.
Okay.
You know, there's no such thing as a bad question, so call your pediatrician if you're concerned about anything.
Okay.
He received his hepatitis B vaccination while he was here. And it looks like there's some other information on here for you for your reading pleasure.
Okay.
Do you have any questions about his discharge?
No, you seem to have answered everything. Are there any resources for me outside of the hospital that I can utilize?
Absolutely. Oh yeah, there's all kinds of good stuff. We have, well, you'll take this home with you. This is your New Beginnings book. There's all kinds of information in here about your care, his care, what to expect with breastfeeding, the first couple of days of life. Also, on the inside cover here is our lactation department.
Okay.
So you're welcome to give us a call back up here. Most insurance companies will offer some lactation visits as an outpatient, and they'll cover a few.
Okay.
You can give them a call, figure out what they do cover, and then call us.
Okay. Cool.
All right.
Yeah.
So that's in your New Beginnings book.
Okay.
All right. Okay, so now we're going to go over your discharge instructions.
Okay.
It looks like you have a prescription that's been sent to your pharmacy, the Walgreens on Northwest Highway in Lemon.
Okay.
Okay, is that your pharmacy?
Yeah.
Okay, very good. You have there for you to pick up is your stool softener, and that's 100 milligrams. You're going to take one by mouth every day as needed.
Okay.
And also your ibuprofen is there.
Okay.
600 milligrams. You're going to take that about every 6 hours. Also, it looks like your physician ordered you some Percocet to take home. You've been taking that here in the hospital, and that also. No, you have the physical prescription for that, so you need to
Actually go
keep
get it.
keep track of that. Don't
Okay.
lose it. They can't call that in for you. You have to actually physically have that one.
Okay.
So I gave you the ibuprofen this morning at 9. So at 3 o'clock you can take your Motrin again.
Okay.
I would take the Motrin around the clock, and then if you have some breakthrough pain, take the Percocet.
Got it.
Use the Motrin as kind of your standard, and then use the the Percocet just kind of as needed. As long as you're taking the Percocet, continue taking the stool softener. The side effect of that narcotic is that it makes you a little constipated.
Okay.
So you want to actively work to kind of treat your bowels at this point. Okay.
Are those medications safe while breastfeeding?
Yes, everything we give you is safe for breastfeeding. Okay, let's see here. All right, so we're sending you home today. The phone number that we have for you is 940-210-3050.
Right.
Okay? When you get home, in case of any emergency, you need to dial 911. You're most at risk for 2 things after having a baby. One is a postpartum hemorrhage, which is where you just bleed uncontrollably from your uterus, and the other is a stroke. So if you have any shortness of breath or breathing problems, chest pain, changes in speech, numbness or tingling on just one side of your body, or any uncontrolled vaginal bleeding, you need to dial 911. Okay? You're going to call your OBGYN if you have a fever of over 100.4, bleeding that soaks a pad every hour for 2 hours in a row. Okay? So the difference between heavy bleeding and a hemorrhage is that heavy bleeding is you saturate a pad in an hour, you change it, you saturate it again the second hour. That's heavy, call the doctor. Hemorrhaging is when you're literally soaking a pad in like 10-15 minutes. You're not stopping bleeding. That's when you dial 911. Okay? Okay. Yeah, if you have any bad smelling vaginal discharge, if you have any unrelieved incisional or abdominal pain, you're going to call your doctor. Okay? If for some reason the Motrin and the oxycodone, the Percocet that we gave you is not working for some reason, then give them a call. Also, it's going to be important that you look at your incision a couple times a day, okay? Look it in the mirror. If you can't really visualize it real well, have your husband, look at it or take a picture of it. It's nice to have that ability as well. If it looks like it's becoming red, swollen, warm to the touch, if it begins to open up at all, then you need to go ahead and call your doctor, okay? It's normal to have what's called it's called serosanguinous drainage. It's kind of a clear pinkish drainage. A scant amount of that is normal at this point, okay? Also, those steri strips that we put on there after taking the staples out, those will stay on for about 7 days, okay? I gave you extra to take home. If one of them gets kind of dingy and gross and falls off, then take it completely off and replace it with a new one, okay? In 7 days, if they're all still hanging on, you can go ahead and take those off. Okay. All right, other reasons that you would call your doctor is if you are nauseous, vomiting, if you have diarrhea, if you're constipated, if you feel like you gotta pee but you can't pee, like you're retaining urine. We wanna make sure that you're not having a urinary tract infection. So that looks like burning sensation when you pee, blood in your urine, okay, if you have any blood in your stool, any of these reasons you would call your doctor. Sore throat, blurred vision, severe headaches, okay. If you have any pain in your calf, like a sharp stabbing pain in the middle of your calf, we want to make sure you're not getting a blood clot. Okay, so give the doctor a call. Also, it's normal after you have a baby and they cut the umbilical cord for your body to be left with a lot of extra fluid and blood. So instead of it overwhelming your heart and your lungs, your body does the safest thing and it puts it in the most dependent position, which is your leg, your feet, your ankles. So if you weren't really swollen before or during pregnancy, you might notice a little bit more swelling after, and that's normal, okay? As long as you're not holding on to the fluid, you're not retaining fluid. So if you're gaining 2 to 3 pounds in 2 days or 5 pounds in 1 week, you need to go ahead and call the doctor and let them know. It is not normal to swell upper body. So chest, neck, face swelling, go ahead and call the doctor. All right, after having a baby, you're exhausted. You're gonna be very tired for a while. If you just have some decrease in activity, trouble sleeping, changes in behavior, to the point where, you know, a lot of this is a setup for postpartum depression, postpartum blues, you're just feeling very sad. If you find that you're having trouble bonding with Johnny or taking care of him, feelings of hopelessness, helplessness, go ahead and give your doctor a call and get some help, okay? You're welcome to call us back up here as well. Also, in your discharge rider, there's a whole list of pregnancy, parenting, and depression resource list. The Postpartum Support International phone number and website is in here as well. All right, so just know that you're not alone, okay? Women get sad sometimes after having their babies. About 20% of all women experience these postpartum blues, okay? However, if those feelings turn dark and scary, like you want to harm yourself or you want to harm your baby, you need to dial 911. Okay? All right, let's see what else we've got. Okay, as far as your activity is concerned, you want to just kind of match your activity level with your energy level. If you have energy for it, it's probably permissible for you to do it. Just don't get crazy, okay? Don't decide to go for a run or start lifting heavy weights or anything, okay? You're actually on somewhat of a weight restriction at this point. We don't want you lifting anything heavier than Johnny, okay? He in his car seat is a little too much weight right now, and it's just awkward, okay? So get help for the next couple of weeks hauling him around, okay? You are on pelvic rest, so nothing in the vagina, no tampons, no douching, no sex, okay? If you're taking your narcotic pain medicine, the Percocet, please do not drive, okay? We want you to take showers at this point. We don't really want you soaking in a hot bath. You know, you're still bleeding for a few weeks, so you don't need to be in a hot bath for 45 minutes soaking it up with the bubbles. Okay, so take showers at this point. You're on a regular diet. You need to increase your calories by about 500 calories more a day than you otherwise would eat, just to help to protect your milk supply and make sure that you have good nutrition for yourself and for Johnny. Okay? Let's see here. I think that's about it.
Okay.
Do you have any questions about any of that we've just gone over?
No.
Okay. And it looks like you're up to date on your Tdap, which is your tetanus, diphtheria, pertussis, and your flu vaccine.
Yes.
If dad or grandma or aunts and uncles, close friends that are around Johnny a lot, if they don't have the Tdap vaccination, it is encouraged that they all get it as well. Okay? And it looks like your doctor wants to see you back in her office in 4 weeks.
Okay.
Okay? All right. Any other questions about any of that? Okay. Very good.
Thank you.
You're welcome. Okay, and this is kind of his working clipboard that he's had with us while he's been here. A couple of things we want to make sure that you go home with. Oh, this is your copy. This is your discharge instructions here. I'm going to set it next to Johnny's discharge. So here is his most recent jaundice level.
Okay.
So at 72 hours, he's low risk for jaundice at about 10.1. Okay. So this is your copy that you'll take with you to your follow-up appointment.
Okay.
All right. And then on here also we have the receipt that we did the first of the newborn screen tests. You'll take that with you to your follow-up as well.
Okay.
Okay? Okay. All right. I'll go ahead and cut the alarms off. And then whenever you've got him Dad's back up with the car seat, and we've got him settled in it. Give us a call. We'll cruise by with the wheelchair. We'd like to escort you down to your car.
Okay.
Okay?
Thank you.
All right, you're very welcome.
Appreciate it.